Tonight,
His skull is open.
a highway car crash puts the call taker in the front seat.
We need to control that bleeding, okay?
And a mobile patient
Trying to work out the best way for you. It's like playing Tetris.
requires an extreme extraction.
And the special unit, and they'll take it out that window.
We have to be so careful, so we're just really on edge.
A patient on the run causes alarm.
Go in the car, go in the car. She's holding something, I don't know what it is.
Exclusive access from the operations centre
Just keep doing that CPR until we get there, okay?
to the paramedics on the front line,
We're just here to make sure you're okay.
fighting to save lives. These are the stories behind the lights and sirens
High five.
of Queensland Ambulance.
Every time you answer that phone, it's like, what am I going to get?
It's the start of the day shift for the Queensland Ambulance service in Brisbane.
Bye, guys. Have a good day.
Before we leave, where did I put my sunglasses?
In the operations centre, call takers are the first point of contact.
Ambulance, what is the town or suburb of the emergency?
You've got a fire in the house. I'm going to tell you how to stop the bleeding, okay?
In a typical 24-hour period, they'll answer more than 1,000 000 calls in Brisbane alone, and their advice can be the difference between life and death.
Ambulance, what is the town or suburb of the emergency, please?
Well, there's a guy in the car in a Toyota Land Cruiser,
Yeah.
completely total, and he's just laying there unconscious.
Okay. Just one single car?
Yes. Anyone in the car? Yes,
All right, stay on the phone, okay? Are you with the patient now?
yes, I'm with him.
How old does he look? Or how old is he? How old does he look?
He looks in his early 20s.
Okay, is he awake?
No, he's unconscious.
Is he breathing?
Yes, he's breathing.
All right, help is on the way, okay? Stay on the line.
Thank you so much.
All right, now, are there any chemicals or other hazards involved?
Yes. There's the battery liquid, and the motor's still running.
The motor's still running. Okay.
Hey, buddy.
Is he trapped? Is he trapped?
He's trying to get up.
So he's awake now?
Yeah.
Is he trapped in the vehicle?
No. His skull is open.
His skull is open. Okay, what's your name?
My name is Noah.
Okay, Noah, I need you to pay attention to my questions, okay? Is he trapped in the vehicle?
Yes, he is.
Okay. Is he trapped in the vehicle or just encapsulated in there? Is there a part of his body that's trapped?
Yes, his legs are trapped.
He's got crushing injuries.
Yeah, on his leg.
All right, is there any serious bleeding?
Yes, to his head.
We need to control that bleeding, okay?
Right then.
All right, put a firm pressure on the wound, press down firmly, okay? On his leg and his head.
I can't get to the gas when he says no.
Just try your hardest, okay? You're both doing really well.
Yeah, I'm sorry, I'll try my hard going.
Is it safe for you to be around that vehicle?
I'm not sure.
Okay, all right, do your best, okay?
I will. Hey. You want to lay that down? Come here, brother, I've got you. Don't worry about it.
Yeah, you're doing really well, Noah. Keep encouraging him, okay? How's that bleeding going, Noah?
It's not good.
Yeah, okay, all right. Just firm pressure, okay? Just keep it on there for me. Apart from his leg being trapped and his head injury, what else can you see?
He may have crushed knees. Hey, brother, please don't do anything else, please, brother. Come on, brother, I'm here to help you. I promise you. Thank you. I'll come with you to the hospital if you want. Please, I just need to see you.
Noah, what's happening?
He's literally in the box.
Is he still conscious?
Yeah, he's still conscious.
Okay, all right, keep talking to him, okay? Comfort him and just keep that bleeding under control.
Hey, bud.
Are the police there, are they?
Yeah,
All right, I'll leave you with the police. Thank you for your help, Noah. You did really well, okay?
Right, thank you so much.
Okay, bye-bye. Oh, my goodness. Yeah, his car is completely totaled and he's trapped in the vehicle. Both of his legs have been crushed and one of the legs is what's trapping him in the vehicle, and apparently half of his scalp is missing. And he's only about 20 years old. Sometimes in those situations all you can really do is just comfort someone. Just at least like being like a positive person there for him is a good thing. This part of the job sometimes leaves you wondering, but QPS said it's not looking good.
Paramedics Ben and Rachel are from the Nathan Ambulance Station. They spend around 50 hours together each working week.
Happy anniversary, by the way. I think the first anniversary paper or something. Number 2, tin. I don't know.
What?
Tin? There's like a certain material that you're is assigned to like each year of marriage.
We often laugh about it because I don't think I've spent more time with anybody else in my life than Rachel. You know, 13-hour shifts, close proximity, you're sitting a metre away from each other. How could you, you know, get any closer to anyone else?
So
10,
year
well, that
2
doesn't
of
sound
work
very
marriage.
impressive.
No, it doesn't. I think I have to wait till like 20 to get any kind of glistening rock.
I think we need to accelerate it in the ambulance world because you change partners a bit quicker.
I'll look forward to a diamond then, quite soon.
So you see them more than your own family and friends usually, and then on top of that you're doing every weird and wonderful and wacky and intense and funny job that you could imagine. So it's a very weird, close bond.
I give you the gift of working with me every shift, and that should be enough.
Is that it? Is that all I get?
He's seen me through every range of emotions that I could possibly go through, and him the same.
Ambulance, what is the town or suburb of emergency?
My partner had a heart attack in November.
Yep.
He's just woke up spewing and he's just looking at me blankly. Yesterday morning he started slurring some words.
Her face is gone like around her mouth. It's gone like a light blue.
Okay.
She's not taking any breaths in or out, but her heart rate's normal.
I called police before regarding this girl that I saw in my house, and then she went across the street to a different house, and she looks like she has some mental health issues.
Okay, is this in regards to a female wearing a black jumper and pants?
Yes, that's correct.
Okay.
She's still there. I'm not too sure that she does have full cognition.
No worries, we're coming as quick as we can, okay?
Ben and Rachel in car 451 are the nearest available crew and are 7 minutes away. Because of the unpredictable nature of this case, police have also been dispatched.
We're going to a mentally ill person, the female having a mental health episode. Female is sitting on the ground, playing in the dirt, does not appear cognizant of her environment. Police on the way.
The number of people presenting to Australian emergency departments with mental health-related issues is on the rise. The latest 12-month figure is more than 286,000 cases.
For me, these jobs are some of the most challenging that we go to because often the details are so vague. The only information that we get is that someone's playing in the dirt. That's not something that you read about at uni or in a textbook. And there's often a bit of a mix of social situations and mental health and sometimes drugs or alcohol. And you're trying to use all of your experience and knowledge to figure out what's going on and where we fit into this case and what we can do for these patients.
Oh shit, there is someone playing in the dirt over there. Just be a bit careful. Don't know what she's gonna do.
A lot of people talk about having a sixth sense and a feeling that just something isn't right. Before we even got out of the car, something didn't seem quite right with the patient.
Hello. Did you ring us?
Yes, I did. I called the police before.
Yep.
Just she was across the street, was playing with dust on the ground.
Okay.
And went across to that house there.
Did she do anything dangerous or?
In situations where someone else has called us on behalf of the patient, It's a very different dynamic. That's one of the few times when we might not be welcome, but we still have to, as part of our duty of care, enter that scene. You can be trained to deal with a dangerous situation, but the real dangers that we face at work is the unpredictability of patients. The instances where paramedics get injured is when we're called to a seemingly safe scene, which quickly becomes unsafe for us.
G'day. Go in the car, go in the car. She's holding something, I don't know what it is.
Paramedics Ben and Rachel have been called to a patient displaying unusual behaviour.
G'day. Go in the car, go in the car. She's holding something, I don't know what it is. What have you got there? Oh, just a pen. Hello. What are you doing? Come and have a chat. I'm just from the ambulance.
Curious,
You just gave us a fright. Where are you headed? 451. He located a female matching the description, possibly drug affected. She's just sort of wandering around. Can't give you anything more specific than that. She crawled through a fence and just walked off. I guess we'll drive around and try and take up with her, but at the moment we don't really have much to go off. She didn't look injured or anything like that. She just said, oh, I'm okay, and walked away. I don't know.
The patient is displaying behaviour consistent with the use of methamphetamines.
I don't think she's okay.
No, we have to be so careful, so we're just really on edge.
Most of the time, the dangers we see with people that use methamphetamines are self-inflicted injuries, whether intentional or accidental. So I might be running in front of a car or inflicting harm upon themselves with a knife.
We've got the police coming too, so we'll try and find her and make sure she's okay. Thank you.
The way you spoke to me, I knew you were fine.
I just wanted, like, anyone at risk to... Oh, police. It's this bystanders rang us for this woman who's playing in the dirt, and then we've come into this property and she was playing in the dirt. She's seen me and she just walked away. She looked like she was on drugs. Okay. So she was walking in that direction? Yeah. Yeah, thanks, guys.
Very rarely does someone start their day and say, oh, I want to hurt a paramedic. It's a very small amount of the assaults that happen. But you have to, at all times, know that your safety and your partner's safety is the #1 concern.
Ah, the police are good. Well done, everyone.
Ben and Rachel need to assess the mental and physical health of the patient to determine if she needs help from a hospital.
I found your pen.
Okay.
I'm Benjamin, and this is Rachel.
Hi.
Hello, what are you doing? Well, someone rang and said that you were acting strangely and playing in the dirt.
Yeah, I was just like looking at the leaves and that.
Oh. Is everything all right? You're sort of moving around a lot.
No, everything's fine.
Have you had any drugs today?
No, sir.
No?
You just asked me the same question.
You said yesterday, didn't you?
Yeah.
Ah, okay. So some drugs yesterday. Was it?
Methamphetamines yesterday, yeah.
Okay. Just to make sure there's nothing wrong, you don't have any medical issues or anything like that?
Just like talking to myself sort of thing, like...
Oh, like...
So like...
Schizophrenia?
I'm not sure, like... What?
Drug-induced psychosis, maybe?
Maybe.
Yeah, okay. How do you think that's all going at the moment?
Well, they're... I get a referral to see a counsellor or what have you, like... Yeah. Or whatever, but they suggested a counsellor would be, like, more appropriate, sort of like... Yeah, that's pretty good.
Any issues with your mental health today, like feeling suicidal or wanting to hurt yourself?
Definitely not, no.
Okay, good. Oh. Is it all right if maybe we sit in the gutter and Rachel does your blood pressure?
Yeah, of course.
Awesome, thanks. Your heart rate's a little bit quick, but that's sort of to be expected if you've had some amphetamines.
It feels nice, it's cold.
Sorry, mate?
It feels nice cold.
Oh, does it?
Yeah.
The cold metal. 140 on 90.
Okay. Well, everything looks all right. Do you think there's any reason you need to come to hospital? Are you feeling sick in any way or anything like that? Yeah? Just to make sure you know where you are and everything like that. Do you know what month we're in? Good.
It's not at a significant risk of harm
No,
because of it.
to herself or anyone else, yeah. That sounds pretty good.
It does.
She actually seems pretty reasonable.
Yeah.
So is that your pen, is it, with the diamond on it? Do you want it back? Oh, thanks, Rach. It's very pretty. And I'll tell you what, from about 10 metres away, it kind of looked like a knife. That's okay, we're a bit on edge, and it's a big shiny thing on the end. It's pretty...
The mental health jobs that we go to make me feel a bit powerless at times because we're not mental health clinicians, we're trained in resuscitation, and sometimes all we can offer them is a bit of a chat.
No, don't be sorry, that's okay, as long as you're fine. All right, no worries. Good outcome. Great outcome.
Yeah. Quirky job.
Yep. It's all just the risk, isn't it? Like, she wasn't actually a scary person.
No. But it's a good lesson in keeping your wits about you, hey?
Exactly. All I saw was someone holding something shiny.
Instead of 10 metres away, she was just around the corner and she had that there. What would you have done?
Maybe gone hands-on. Like, I would have, like, quickly decided, like, run or fight.
Yeah.
And then maybe, like, try and grab her hand or something.
I would have come back you up.
I hate when you watch the movie and the girl stands there while the guy gets beat to death, and the girl could just go in and grab the
That
knife.
would never happen with us.
Like, help him now. Good job, team.
Yeah, good job.
I was at my friend's engagement party and like this platter was going around of like garlic barbecued prawns. And they were like huge. And they just looked so good. And I just grabbed one and ate it and everyone's like this.
Oh my God, I'm so proud of you. You ate a prawn.
I did, yeah. Who wanted one? So I had one. So I feel like my...
You're vegetarian though, you're not vegan.
No.
Yeah, it's fine.
No, just slowly eating animals.
Well, you had one prawn.
But I still don't think I'd eat fish.
Oh, really?
Oh, no.
Why, because they're smart,
Yeah,
right?
yeah.
What are calamari dumb and prawns dumb?
They get caught.
How do you justify that, right?
Because prawns are just... And they're just nerves, that's all they are. They don't have a brain, they don't know what's going on. It's the same as eating a mushroom. Like a mushroom just being... I like your legs. A prawn.
However you need to justify it so you can eat it, Rach, that's all that matters.
Ambulance, what's the town or suburb of the emergency? Ambulance, tell me exactly what's happened.
There's a drug overdose.
Drug overdose?
Yeah, heroin.
Heroin, okay. And are you with the patient now?
Yes. She needs an ambulance.
Okay, I've got the ambulance coming out to you. Is she breathing normally?
No.
We're going to a 30-year-old female who was overdosed on heroin. She's unconscious.
The number of Australians dying from accidental drug overdoses now exceeds the national road toll by 31%. That's almost 400 more deaths a year.
So put your ear next to her mouth.
I don't hear any breath.
You don't hear any breath? Okay.
No.
All right, so we need to start CPR.
CPR?
Yeah?
Yes. Yes.
All right, so I'm going to tell you how to give mouth to mouth. Now, I want you to place your hand on her forehead and your other hand under her neck again. Pinch the nose.
Pinch the nose.
Close and completely cover her mouth with your mouth. Now, you need to blow 2 regular breaths into the lungs.
When I'm on my way to someone who's stopped breathing, go that way. For every minute that it takes us to get there, that's another minute that that patient's brain and their organs have gone without oxygen. Every second that we can save on the road is going to give us a better shot at saving that person. Move!
Advanced care paramedics Ben and Rachel have been dispatched to a heroin overdose. They are 4 minutes away. Life-threatening emergencies require a multi-crew response. Critical care paramedics Jason and Grace are also dispatched. They're 7 minutes away.
I love going to the big jobs. I guess it's the whole experience of seeing the big job pop up on the screen, 1 Alpha, and the adrenaline rush you get from that, and thinking, right, this isn't fun and games, this is a big job, this is serious, this is when I need to be at my very best.
There's an ambulance right out the front. Don't leave her side though. They'll just... Yeah, stay with her. They'll be in with you shortly. Yeah. Is that the paramedics with you? Okay, I'll leave you with them.
I think, I don't know.
Has she done heroin?
Yes, she has.
Oh.
Intravenously. Yeah. Probably used.
When did she have it?
Just under a point, maybe.
Yeah.
Yeah, and...
How long ago?
25 minutes ago.
Okay.
But she's had some benzos, not knowing, I don't know how much of them she's honestly had.
Okay. What's her name?
Her name's Diane.
Diane. Hello, wake up for me, Diane. Wake up.
The patient has been unconscious for 7 minutes.
Not responding.
Heroin slows the messages between brain and body, causing breathing to slow and sometimes stop.
Do you just want a ventilator while I plug that in? Sure.
These jobs are as time critical as it gets. If someone is not breathing, every second does count. So when we arrive on these scenes, we need to very quickly establish what's going on and start ventilating, which means breathing for the patient to get oxygen circulating in their body again to prevent damage to their brain.
Can you do some jaw thrust for me? Yeah, that's good. Look at her airway there, look pretty good. Oh, that's better. You stay there.
Yep.
I'm gonna hold that in. Now, can you hold this and inflate that for me?
Yep, you got it?
Yep.
It's great after working with Rachel for so many years because we can almost communicate telepathically. We have a bit of a unspoken language between each other. I can be about to turn around and ask Rachel for something, and by the time I've turned around, she's already got it in her hand, passing it to me.
Yeah, the master's there on your left if you need it.
Critical care paramedics Jason and Grace have arrived to assist.
Oh, hey, Grace.
Yeah, I'll just hop out.
It's a heroin overdose.
Yep.
And she's GCS of 3. She's hemodynamically well. She's got a breath rate of maybe about 6. With a good airway, we've just inserted an LMA and it appears to be working really well. Stats are 100%, heart rate's 115. We're just sort of still doing our initial set of obs now.
First we ask ourselves, guys, I guess, do we wake her up? Now we try and wake her up to see if there's a lot of opiate effect on there, or do we keep her asleep? The decision between waking up a patient with Narcan, which is the reversal agent for a heroin overdose, or not, is often a complex one for paramedics. With heroin, if we reverse the heroin overdose, it can sometimes unmask some unwanted effects of some other drugs.
Maybe some small incremental doses of IV Narcan to see if we can get some response out of it.
Is there a plan if she does wake up agitated, aggressive in this small space?
One of our big concerns is the way that they're going to wake up. It's not just about how they feel about us being there. Sometimes it's about the fact that this patient's been deprived of oxygen for a long time, and that can make the brain really irritated and make the patient act violently.
So what we do, if she does wake up a bit scared, we do to just reassure her for us.
Yeah.
Is that okay?
Okay.
What do you want to try and do?
It's another 100.
Yeah, you might be bored.
D! Open your eyes! Open your eyes!
Any trap squeeze at all, mate?
D! Open your eyes! Hello? Hello?
Hey,
It's okay.
Hey.
It's all right.
Hey, man.
Hello.
Just slowly pull it out of your mouth.
Hey, dude.
Good girl.
It's okay.
It's all right.
Well done, darling.
Do a cough, D.
Big cough.
Big cough.
Big cough.
D.
Good girl.
D. Hello?
Well done. You happy there, Ben?
Yeah.
That's it, D. Good girl.
Hey, D.
Hello.
Take a breath.
It's all right, sweetie. It's the ambulance and your friends are here.
Hey,
Just the ambulance, darling. Hello. Hello, sweetie. It's okay.
It's okay.
Nice and slow.
You
Good
relax.
girl.
You relax.
Hello. Good girl. You're safe. Hello.
Cords everywhere. Hello.
Hello. It's just the ambulance, darling.
It's the ambulance.
You're safe.
One of the things that could happen with this patient after we've given her Narcan is that it could wear off before the heroin wears off.
If that happens, she's at risk of going unconscious and stop breathing, and that could result in some really serious or fatal outcomes. For that reason, we need to take her up to hospital so that she's safe to return to the community.
It's all right. You didn't breathe for about 30 seconds.
Really?
Yeah, and your oxygen went from 98, just went, watch it go down, 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 down to 87.
Yeah.
Yeah. It's coming back up now. 94. Wow, it changes quick. 96, 99.
Breathing is truly important, isn't it?
Breathing is important. You don't last long.
Prior to being a paramedic, I think I was quite naive about the amount of people that use drugs and what a problem this is in society.
Don't feel like an idiot. I don't think you're an idiot.
It's really opened my eyes over the last years working as a paramedic at the prevalence of drug addiction and the damage it does to families and society.
I'm just glad you're all right.
It's really difficult to see it every day at work.
You might not care much, but there's a really beautiful rainbow outside.
She might care.
The Queensland Ambulance Service's 12-hour night shift is about to start. The call takers in Brisbane can expect to answer a 000 call almost every minute of the night.
Ambulance, what's the town or suburb of the emergency?
Dress 501453, logging on Sunnybrook Station. Good evening.
Starting their shift in Ambulance 453 are paramedics Matt and Patia.
Do I have chocolate on my face?
Chocolate and cat hair and dog hair. We've got our first job in. So we are going to 30-year-old male. He is conscious, he is breathing.
Yeah.
Problem is he's wearing his underwear.
Oh my God, this is gonna be good.
How do you strike up a conversation with a man in underpants?
Do you know the last time I went to a man in underpants said that he had a bomb up his bum?
Ooh. Really? Did you take that threat seriously?
No. Because he bent over and pulled his cheeks apart.
How did that make you feel?
Violated.
I do like these jobs. It's something different.
Something different? Do you want to yell out and ask if they've seen anyone in their pair of underpants?
Here we go, I'm going to ask this person. Hiya. How are you?
Hello.
How are you?
Good, thanks.
Good. How long have you been standing here?
About 1 hour.
1 hour?
Yeah.
Have you seen a man run up and down this road in underpants?
I haven't seen one.
No?
I haven't seen one.
No worries. If you see one, you phone 000, yeah?
000.
Yeah.
Excellent.
Okay.
Thank you, mate. I don't know what colour of underpants.
Oh.
It might be white, green, I don't know.
Yeah, I will call 000.
Excellent.
As soon as I see you.
Thank
The
you.
ambulance.
See ya.
Thank you so much. Thank you.
Ooh.
What?
Someone's running.
Where?
Yeah.
I don't see anyone running.
Ah, damn it, he's wearing pants.
I really wanted to find him.
So did I. 453, we've been the whole length of Warrego Road and found no patient wearing underpants running up and down the road. Would you like us to keep looking?
Just nearby 453. I would imagine not.
Roger.
In the operations centre, call takers continue to respond to a steady stream of calls.
Oh, this kid jumped up and put his head into the moving fan, and it kind of sliced his head.
Done that before.
Have you?
You know when you get changed and you put your arms up to get changed and you put your hands in the fan? I've done that 3 times.
Well, I wouldn't know, Jared, because I'm not as tall as you. I can't reach the fan.
I've had a fall and I can't get up.
Okay.
I'm all right, I'm not hurt or anything, I just can't get up.
Okay.
Okay, and what part of the body was injured?
She's got a huge black eye, big bruise on her shin, and she's laying on the floor in the bedroom.
Okay, and when did this happen?
She said she fell last night, and she said she can't, hasn't been able to get up or move. So she's obviously been there since last night.
And how old is she?
Mum, how old are you? 77. Yes.
77, okay.
501 453.
453.
Yeah, I might get you pushing towards 8 Mile Plains if I can.
We're in 8 Mile Plains.
453, we're pretty close anyway, so we won't be too far if you put that job on us and clear the underpants.
Matt and Patia have been assigned to help another crew lift an injured elderly lady who lives alone. They're 6 minutes away. Paramedics from Ambulance 264 are on the scene and have assessed the patient.
So unfortunately, she's been on the floor since last night.
Really?
Yeah.
No.
It makes me sad that someone has been on the floor for that long.
Yeah.
Almost half the population over the age of 75 lives alone.
Being able to help the elderly when they really need it, it's a good part of our job. It's the times that they're unable to get help straight away, when they're laying on the floor for numerous hours and they can't contact anyone to say, hey, I need some help. I think that's the more devastating part of being a paramedic and walking into that house.
Quite a hematoma to the left eye, hematoma to the head, queries from neck pain, pain to the left hip with shortening and a bit of rotation, pain to the left to the right elbow, and quite a swollen right knee. We'll just have a look at some extrication, but I think it's going to be quite difficult to go down through these stairs.
Hello.
You're popular today.
Sorry, Tanya. We're trying to work out the best way for you with the least amount of pain. But that staircase is not good. Can we bend to the knee? The only thing I was thinking is we're going to need to bend it potentially to get around the corner.
Yeah.
Now we won't be able to lift that knee up because it'll affect the hip.
Yeah, I know.
But
All right, I'll have a look.
the main difficulty with extricating this patient is the staircase. It's a nightmare.
It's 7:45 p.m. and paramedics Matt and Patia have been called to help extricate a 77-year-old woman who's fallen and been on the floor for 24 hours.
Sorry, Tanya. We're trying to work out the best way for you with the least amount of pain. But that staircase is not good. It's like playing Tetris. The main difficulty with extricating this patient is the staircase. It's a nightmare. We can bend the knee and then we can rotate her a bit easier.
The other option is QFES and the special unit.
Yeah.
I've used them before and they'll take her in that window. Guaranteed they'll take her out.
Do you think they'd do it?
Yeah, they love that stuff.
It would be easy if she didn't have so many injuries. We have to lay her straight because she has potential neck injury and a potential hip fracture. So calling QFES to help is clearly the best decision and safest option for our patient. We're calling you in regards to this backup for 264. This staircase, I tell you, is like playing Tetris with a spinal board. I like to treat the elderly like I'm treating one of my own family members.
Just gonna give you some more pain relief, okay?
And to give them that respect and that dignity, I think, is really important in our job. This is your dressing gown. I'm going to put it on in reverse, sort of like a hospital gown, yeah?
We'll just tuck you in like a bug in a rug. I love working with the elderly, just due to the fact that I lost both sets of grandparents when I was younger and probably never really got to know them fully. This job has allowed me to do that and get to know the older generation, and I feel strongly advocating for their rights and what they need. That's the boys.
Yeah.
Yeah. So the bedroom's there, that's where she is. We've got two 90-degree angles in the stairwell, really short, tight, steep. But that window is kind of looking the best to get straight out if you can do something with that. Patient safety and care is still paramount while this extrication is going on.
We're going to lift you up on this hard board behind you and then going to pass you into the cherry picker, out the double-story window. Yeah?
Having the patient pain-free, comfortable and in the know of what's actually going on is very important to their sort of mental health. This is MacGyver stuff. I grew up in the 80s, like I grew up with 18, Knight Rider, Airwolf, MacGyver. They were normal people, but they just did good, you know, helping people. And I think that stayed with me through all my various jobs.
Are you as comfortable as you can be?
Yeah.
It's quite a daunting process to have just one paramedic crew in your bedroom, let alone 2 paramedic crews and 3 fire engines outside, red and blue flashing lights, and multiple fireys coming into your bedroom saying, we're going to take you out the window.
You got that one? Right, we're going to go down, level to the stairs a little bit. Yeah. Johnny, you all right? Yeah. We'll go right there. All yours, mate. I haven't got it. All right,
Yeah. Sorry if it's a bit cold out here.
Yes, this is an extraordinary way to get you out of your house, but it's the safest, most appropriate and most comfortable way to get her out of her house.
Thanks for that, mate.
It's by far the craziest nana-down job extrication process I've ever had in my life. Never in a million years would I expect that we call a cherry picker to pull a lady out the window.
I think that was more satisfying for Tanya. Like, that was so easy and less painful, less traumatic than if we used that staircase.
Smooth. It's a pretty special relationship we have with the other emergency services. We don't really train with each other that often, but when we do come together, we all seem to have the same idea of what we're aiming to achieve. Wow.
That was awesome.
That was awesome.
Yeah.
That's exactly how you'd think emergency services would work.
Yeah.
Combined effort.
Yeah.
Combined problem solving.
All for the benefit of a patient.
I thought it was fantastic.
Well, if this is the start of this night shift, bring it on.
Yeah.
Three hours into the night shift, and QAS in Brisbane has received one call almost every 60 seconds.
Tell me exactly what's happened.
My son, he's anaphylaxis. He's coughing and struggling to breathe.
There's a snake in our backyard, and we don't know if one of our dogs got bit. I'm just scared that our dogs got bitten.
Ambulance, tell me exactly what's happened.
I've actually got my daughter-in-law here. She was due last Saturday for a baby, and she's going into contractions, and they're only about 5 minutes apart.
Okay, is this her first delivery?
No. 6, 7th one.
Does she have any high-risk complications?
Yeah, she has. She was actually told if she has any labour pain, she has to go straight to Royal Brisbane.
North of Brisbane, new graduate paramedic Jack and her mentor Murray are heading lights and sirens to a woman in labour.
All right, so we're going to a 35-year-old female who is having contractions 5 minutes apart. She is 40 weeks plus 6 gestation. This is her 7th delivery.
Sorry, hold on, come around the corner.
Experienced paramedic Murray has been with the service for 6 years. For Jack, it's been 6 months.
You haven't done a baby yet?
No, it's sort of the one thing I want to do is deliver a baby. Have you delivered a baby?
Well, I've done 10 this year. Good.
You've got to be kidding me. 10?
A fast response will enable Jack and Murray to assess the situation and decide if they have enough time to make it to the hospital or deliver the baby themselves.
What do you want to know?
If her waters have broken.
Yep.
Any complications with the birth? Anything?
Complications.
As a new grad, it's really hard for me trying to put all the pieces of the puzzle together, trying to go through all my line of questioning.
Again, the contractions.
Yeah, how far apart they are. So as soon as you get the next one, what time it is until the next one.
And then learning what questions I need to ask and what's not really important in that person's case.
Hello. Okay, all right. How far apart are your contractions?
I've lost count after I had a shower.
Have your waters broken at all?
Not that I know.
No? So when you feel your next contraction on, if you can just let us know, because we're going to time them, if that's all right.
Yep.
35-year-old Sarah is the mother of 5 girls and 1 boy.
And with your previous ones, have you had any complications with them?
My second daughter was really quick.
Okay, really quick?
Yeah.
Okay. Starting to get another one.
Contraction coming now. How far apart?
So that's 3 and 7 minutes.
3 and 7, cool. So just keep tracking of how far apart they are. All right, what we're going to do now, there's a bed set up just at your front door, okay? We're going to wrap you up in a towel. I think we've got enough time to get going. It's not going to come in the next 2 minutes. Don't prove me wrong.
Okay, so I'm just going to bring you up now, okay?
Jacqueline, jump in and gown up. Don't worry about anything else. We'll sort all this out. She's having more. Do you want anything else from me before we start moving?
No.
You're all right. You're all over it.
I think it's really reassuring to have someone like Murray as my mentor. He's got so much knowledge and is able to give me the confidence that I know what I'm doing and I can do this job.
So, Jacqueline, you might get crowning on one contraction and it'll be delivered on the next.
Okay.
Okay? If she starts to feel like she's going to push or something's coming, I'll just pull over and give you a hand.
Okay, thank you. That's it.
Sarah is 6 days overdue and needs specialist care at the Royal Brisbane Women's Hospital, 28 kilometres away.
Push. Yep. If you need a push, push. Bear down, okay?
Female patient, contractions are less than 2 minutes. We're going to try and make it to the Royal, but don't know how lucky we're going to get.
Roger, 50123, thank you.
My biggest concern is if this baby comes in the back of the ambulance on the way to hospital, that it's not going to be a normal delivery, which can potentially cause life-threatening complications for both the baby and the mother.
That's it, you're doing really well. That's it. Doing well. Nice deep breaths. That's it.
I want to push.
Okay. If you want to push, you push, okay? We're not going to stop you. You do what your body's telling you to do, okay? I'm pretty sure the mucus plugs.
Are ruptured?
Yep.
I don't think we're going to make it.
Another one. Yep. Yep. Squeeze. That's it. I haven't seen any crowning yet, okay? But I don't think you're far off, okay? Yeah.
Pretty sure we're going to have enough time to get her up there, no dramas.
Yeah.
But we just want to bring everything just in case.
Jack did a really good job. She provided a lot of reassurance throughout the entire process.
I'll lay it down. All right, I'm laying you down. That's it.
I reckon she'll make it upstairs, yeah. I do. She's not crowning or anything yet, but...
While unfortunately it wasn't the outcome Jack would have liked, I have no doubts that if the baby had been born in the back of the ambulance, Jack would have been able to successfully deliver a healthy baby. The delivery of a baby is a job that both call takers and paramedics relish. Just the excitement of being able to be involved in that process and bringing new life into the world is really something special for both call takers and paramedics.
Next time,
calm before the storm.
Australia's busiest ambulance service lives up to its reputation.
Don't stop vomiting and really worried.
What caused you to fall over?
I was drinking.
Like the theme tonight.
With a shocking crash for a young driver.
The head injury, blood gushing from head.
An athlete in agony.
Do you know how far the javelin's gone into his groin?
It's a very important area.
And a commuter's worst nightmare.
Good news is we know what's going on, mate. Bad news is it looks like you're having a heart attack.